Good evening. So before I get started, I do want to thank Jarus Healthcare Foundation and Robert and your team for giving me the opportunity to present at this forum. I know you guys were flexible, always communicating with me on the next stuff and all those things. And I also want to thank Dr. Jan Pringle for also giving me the opportunity to present at this forum. So before I get started, the agenda that I want to cover is just want to briefly touch upon my company, right? What do we do, and what technology platform that we are using to develop some of these apps that we have developed, and then I want to show a demo of the naloxone app that we have, a functional prototype of the app that we have created, and some of the new features that we are thinking based on some of the feedback. And we also want to talk about the warm handoff and the educational app that we are thinking at the conceptual level, and what are the different things that we can do to make people's life a little bit easier. So about Jarus Health, I will not spend a lot of time. I'll just spend a few minutes because the topic is different. So we started this company in 2016. We are focused primarily on the consumer side, mobile apps for healthcare industry. One thing that we do strive on is when you build a solution, it needs to be simplified, and it should be easy to use, right? You see a lot of apps today, tons of apps, but when you go look at it, it is complex and it's not easy to use. So you kind of lose the people who want to use the app. So we kind of focus on it. As an example, recently, WebMD did a study, and they talked to the millennials, and they also talked to the senior citizens. They asked one basic question. The question was, will you use a fitness device or a mobile app? Both of them said no. But when you kind of drill down, why did they say no? The answer from the millennial point was, I would not use it unless otherwise there's an incentive for me. If there is an incentive, then I would use the mobile apps related to health or the fitness device. But when you go and talk to the senior citizen, the reason they said no is because my physician did not tell me to use it, right? So the key is, the point that I want to make is, if you do not have a solution that is simplified enough, and at least from a millennial perspective, you want to make them engaged, right, so that they start using it, you're not going to see the benefit of developing apps. Once again, from a strategy aspect of it, we do want to spend a lot of time in a particular business area and then focus on developing the product. The topic that we are doing today was one aspect of it. As like Robert mentioned, I have about experience of 22 years. Prior to here, I was at Highmark. I was leading various departments, and from a technology aspect of it, we do have experienced technologists. And we are partnered with Emory and UPMC, namely Dr. Jan Pringle. So these are some of the apps that we have developed just to level set. I don't want to spend a lot of time. We do have an app that deals with health plan related. I won't spend a lot of time. And there is another app that we are doing for Emory University that's in the process. It's for medication adherence. What this does is, because study shows that if somebody is watching you and you tend to adhere to the medication so that you get better, right? So what this does is basically lets you assign a buddy system, where you can assign a buddy, let's say your mom, your brother, sister, and as you're taking your medications, you can take your video of you taking the medication and you can send a video through the chat, and they can communicate back to you, and kind of gamification type of thing. So I think the research shows that it improves the adherence of the medication taking. So that's something we are doing. And then from a pain diary aspect of it, you can log your pain, you can look at the history of your pain, and you can take that to your physician so the physician can say how you're performing. So how do we make this happen? Because all these things require rapid development, right? You cannot do this forever. So we do have a platform that we do leverage to create these apps. So it is metadata driven, and we do create application programming interface. I'm sorry, I'm using a lot of technical terms. I will. I know it's difficult sometimes. So by using this framework, we are able to develop an app quickly. As an example, the next slide that I'm going to talk about is Food and Drug Administration recently had a competition for naloxone. We came to know through Dr. John Pringle maybe 3 weeks before the competition deadline. So we had to submit something very quickly. So we were able to leverage this platform, and we were able to create a functional prototype. So the primary user, so this is a challenge that I want to show a video of it. The primary users would be the opioid user. It would be friends and family of the user and any community members. Initially, when we did it, we were focused only on the community members, but in talking to some of the users, they did say that I do not feel comfortable if a stranger comes and administers an naloxone, right? They might be okay in a public area, right, where there is a concert going on, there is a festival going on. If they tend to be overdosed, they're okay a stranger coming in and administering an naloxone. But within a private setting, they prefer their friends, their known people to be able to come and administer the naloxone. So we kind of included that as part of this demo. So the next one, I'm going to show the demo, and you can see what we have designed as far as prototype goes.
Hello, and welcome to a demonstration of Endzone Care, an app-based solution to the growing public health issue of opioid and heroin overdoses. In 2014 alone, nearly 30,000 Americans died from overdoses involving both prescription opioids and heroin, a growing trend in recent years. Naloxone, a well-known medication, is commonly administered to individuals experiencing overdose. Though naloxone is a both proven and available treatment, one of the biggest challenges for the medical community is connecting opioid users with access to naloxone at a moment's notice. That's where Endzone comes in. Endzone is designed with the primary purpose of creating an urgent response network by connecting opioid users with nearby naloxone-carrying individuals in the event of an emergency. So how does it work? When an Endzone user requests for help, the app quickly notifies registered Endzone naloxone-carrying individuals in a 7 to 10 minute driving radius of the request. Notified individuals fall into 3 categories, including friends, who can be added via the app, nearby community members registered with Endzone, and finally, emergency health services, as a final resort if neither friends nor community members are available. When a notified individual accepts a help request, they are provided a Google Maps route to the person requesting assistance. The app also provides instructions on how to use naloxone medications and administer CPR. Now let's demonstrate Endzone in a practical scenario. Eric, age 45, has been prescribed opioids for anxiety issues. His doctor has recommended he and his family members download Endzone as a precaution when he takes his medication. When we first open up the Endzone Care app, we are first prompted to log in. Once Eric has registered, the app will remember all his user information for quick future logins. Family members, friends, and Endzone community members also register in the app. After logging in, we can immediately see that the Help button is prominently displayed on the front page for ease of use during an emergency. Below the Help button, we can also view important information, including the user's exact location and their emergency contacts. One day, after accidentally taking too much medication, Eric experiences difficulty breathing and starts to show symptoms of an overdose. Eric's son, John, knows that his mother normally carries naloxone, but she isn't at home right now. Using the Endzone app on his dad's phone, John presses Help, notifying naloxone carriers within a 7 to 10 minute driving radius of the home. The app first searches for Eric's friends in the nearby area. If no friends are nearby, the app then searches for Endzone community members who may also be in the vicinity. If neither friends nor community members are available, the app prompts the user to call 911. For the sake of this demo, let's pretend that Eric's wife Karen is taking her walk around the neighborhood. Karen carries a naloxone nasal spray in her purse and has downloaded the Endzone app. We can now look at how Endzone works from the perspective of an Endzone friend or community member. Karen first receives a pop-up notification message on her phone. The notification prompts her to accept or reject the help request. When she accepts, Google Maps is opened, showing the fastest route to the help request user, in this case, her husband Eric. Karen administers an urgent dosage of naloxone to Eric, saving his life. Let's now take a look at some of the additional features in the app. First, we can see an education tab, which will contain information on how to administer naloxone and CPR, as well as other drug facts. Below the education tab is the history tab, which shows individuals who have carried out naloxone treatments in the past. The history function will also be used to keep track of users who offer help and be used to offer them naloxone vouchers for future use. Finally, the settings menu is for basic app functions, including changing username, passwords, notification settings, and other options. This has been a demonstration of End-Zone Care. We hope this technology can save lives by protecting our friends, family, and community members from fatal drug overdoses. Thank you for listening.
So one thing this app does also do is there is an online-offline feature. So if I'm a friend that's willing to help, or a community member that's willing to help, let's just say I have a busy schedule. At the time, I really don't want my notification to pop up. You can set the app to say I'm offline, so that when the request goes through, the app does know that, hey, this person went offline. I'm not going to try reaching out to this person. So it does provide that feature so that you don't get pinged every time there is an emergency, but you can go offline if you choose to. So some of the additional features that we are at this point talking about is there a way we can prevent, right? One way that we could talk about is people use fitness device these days, and most of the fitness device do have heart monitor. Is there an opportunity for us to know that the fitness device can be connected to the app, so that if there is an issue with the heart monitoring, right, we could trigger something and have for emergency to come and help? So that's an option. And also, since the app is residing and when it's locked, right, you need someone to enter the passcode, right? So that's really not helping in an emergency, right? So we could do something like creating a widget that could be outside of your. You don't have to unlock the phone. You should be able to ask for help in a simplified way. And also similar to Uber, if you request for help, the person who is waiting for help can see the help is coming. You can show in the map how far are they. So there is that opportunity that we could develop to make this a much better an app. So this is something that we are talking about as a concept, and which we would like to prototype. From what I understand, from a warm handoff perspective, it's typically done as if an overdose person goes to an emergency department, the physicians see them, and if they feel that they don't have to be admitted, right, they call the support specialist. The support specialist comes into the emergency room, talks to the patient, explains the procedures and whatnot, and suggests some treatment, right? So all those things are a manual thing, right? Somebody has to intervene, somebody has to do all those type of things. So we believe a technology can come into play that could help some of these things, right? For example, the communication channel and the treatment facilitator. Let's say, for example, the patient walks into the ED and overdosed, right? And he was given a medication to kind of revive, right? So they are in a stable condition to be able to talk. So at that time, you should be able to connect that individual through the phone, right? Obviously, having a face-to-face conversation is always better, but we know that due to the resource constraint, you cannot have a lot of support specialists readily available, right? So you could do a video session, right? From the hospital, you can talk to the support specialist, or if you prefer a texting, you can do that as well. Peer connection tool, right? You can connect with other people who are going through the same thing that you are experiencing. Sometimes they feel comfortable talking to people that are experiencing the same thing. Crisis management tool, if middle of the night, right? If you have some emergency, you should be able to call your care manager, right? And if the care manager is available, not available, then it can go through your friends and family to come and help you. A medication list provider that can provide all the medication list so that when you come for an emergency, the COE, right, would know what medications you're prescribed. So they should be able to treat you much better. So those are some of the things that we think from conceptually we could develop and the technology could enable instead of manually intervening. And with the millennials, right, they are more comfortable, right, talking through the phone, right, FaceTime, video messaging, texting, all those type of things. And the last one that we are talking about is creating an educational app, right? So we could provide an interactive education to all these people, all these divisions, right? Criminal justice, family and friends, healthcare professionals, and school and work leaders. And we could also provide a naloxone finder option, right? Where do you find the naloxone? And if there are pharmacies who are carrying naloxone, if they want to register, right, they could come here and register. And you could create county and state-based content creation because each state might be different, each county might be different. So you can do all those things. So with that, I know I'm out of time.